I had some back problems and I was getting run over by 1,500-pound animals and just doing kind of dumb things, like picking up feet and stuff like that. And I tried the BEMER subsequent to that and being kind of needing more proof. I would use the BEMER one day and my back would feel 80-90% better. And then I would say, well, that was just going to happen anyway. So I didn't. Second day, back was totally screwed up. And so I did that on and off 6 times and convinced myself that I could actually go to work and not have to hobble around.
I've heard a lot of horse owners talk about that effect that BEMER has on their horses, that calming influence. Yep. But walk us through the science of that. How does that work?
It tends to have a enhanced parasympathetic effect. So the body has kind of 2 modes of action. One is the fight or flight or sympathetic effect. And then the parasympathetic is the vegetative state. So they tend to relax. You see various signs of how the animal relaxes. They may have a particular posture. They may yawn. They may kind of rest their head on things, but it definitely puts them at ease. And BEMER's a class 2 medical device, so that it's not only safe, but it's efficacious for what it's supposed to do. And that is to increase microcirculation or circulation through all the tissues in the body.
Hello and welcome back to another episode of the Longevity Lounge. My name is Ben.
And I'm Caylee.
And today we have Dr. George Barrington, a very seasoned and experienced veterinary doctor of working with large animals that he's worked with, over 40 years now.
Yeah.
And also an incredible professor as well.
Yeah. We talked to Dr. George about obviously his career being a large animal veterinarian and the impact that that's had on his body, how he's been using BEMER for himself, and the research and things that he's excited about for the BEMER horse set. So this conversation is just awesome. We're so excited we got to talk to Dr. George Barrington today. Let's dive in.
Well, Dr. Barrington, it's a wonderful pleasure to be with you today. We're so excited to have you on the Longevity Lounge.
Well, it's great to be here and appreciate your asking me to participate.
Now, before we jump into the real meat and substance of all of this, let's hear a little bit more about your story. And you've been a large animal veterinarian for practicing close to 40 years, I understand. Is that correct?
Yeah, it's been a while. Yeah, I'm retired now, so it's a good thing too.
Yeah, tell me what got you into that? What kind of brought you onto that journey to begin with?
I've spent some time thinking about that, and it's interesting because there's a lot of things that I'm interested in, and really I think career-wise I could have done a lot of things, and there's almost a bucket list type of event. And I grew up where my dad and my granddad had a small cattle operation, and so I was introduced to agricultural animals, and we had horses and all sorts of stuff. So I think that's probably the nidus where it started. And my granddad was a classic country doctor, and one of his best friends was our veterinarian, Doc Bergstrom. And so anyway, I was thinking about that. How did that all tie together when I was 6 and 7 years old? And anyway, went to school. And like I said, I had a bucket list of things to do. And this was sort of one of them. And then you kind of get so deep into it and you need to make a living. That's where I ended up. And surprisingly, I never had any inkling that I'd be back in academia, but I ended up back in academia, and it was a blast. It was a lot of work. It was a lot of fun, and worked with some fantastic people. So had a great time. And then I retired about 2023. And that's just wrap up.
What helped you pivot to practice to becoming a professor at a university?
That is a really good question. I had kind of initial dreams of kind of driving off in the sunset in Montana or Wyoming and, working with cattle. And a good friend and mentor of mine, David Hodgson from Australia, he was an equine internist. He contacted me when I was in practice and asked me to come maybe consider it. And Dave's obviously a very persuasive gentleman, and he somehow talked me into it. And so it turned out to be great. I I looked up to those people. I'd never thought that, I'd be in the running for board certification or graduate school or anything like that. So, and it's kind of like what is it? The blind squirrel finding the nut thing. So, it seemed to work out. So, but I had fun. Yeah.
That's awesome. What about large animals? I'm so curious as to where that pivot came in. Was that from the very beginning that you knew large animals was what you wanted to work with from the experience in the cattle farm?
I think so. The whole industry, and the, ranching and farming and things like that interested me quite a bit. In vet school, you get trained in both small animal and large animal.
Sure.
And, but I don't know. I just had my heart was kind of set on the industry and helping those people out, because I have a lot of respect for that lifestyle and those people that work with horses and cattle and sheep and goats and all that kind of stuff. So, and the other thing is, when I was in practice, we were kind of a mixed practice. And as you get going on that type of thing, you sort of find your niche, and my niche tended to be large animals. So,
Yeah.
how it works.
Do you find a way of kind of connecting there? This is maybe a really obscure comparison, but one of my sons, when he was little, wanted to be a vet, but he was scared of animals. he loved them from a distance, and we had to get a little dog. She's the runt of the litter, little 10-pound Cavapouchon. She's about this big, right? Just to warm them to close proximity with animals. And obviously you grew up very close to animals anyway, but how did you develop that ability to connect and certainly as a vet be in such close proximity, sometimes in an invasive way, right? How did that develop?
Yeah, that's interesting. As you work with animals, obviously you start to learn to read them, and you get better and better at it. And it's I look at people who work, for example, with cats, and it's not that I have anything against cats. I like cats, but I cannot read cats, and they tend to be a
That's
little.
the thing about cats, right? Nobody can read them.
Yeah, you can.
But it's funny. I mean, and I watch people who I respect that work with them, and they can open up a cage, and there's this cat hissing in the back of it. And it'd be like sticking your hand into a buzzsaw as far as I was concerned. So, and they just calmly reach in there, and the cat acquiesces. And at the same time, people that can't read cattle tend to get run periodically. So as you work with whatever species it might be, you just learn to read them, is what I call it. And certainly unexpected things still happen, especially with horses. They tend to be the epitome of fight or flight. It's not, horses work on an on-off switch. It's not like a rheostat. So it's all go or no go. So, but you can read that to a certain degree, although sometimes it happens so quickly you can't. But anyway, yeah.
You seem so calm about it, but was there ever a moment where, I mean, large animals are both beautiful and terrifying to me at the same time. So was there ever a moment where you were like, whoa, or a story that you can think of that was scary to you, or it just does all the same?
Yeah, you sort of, I was thinking about this also, is on the inside, you might be essentially pretty much happy, petrified, whatever you want to call it. But on the outside, you just have to have this, everything's under control. And it's pretty funny because a lot of times things are absolutely not under control.
Not in control, yeah.
I can imagine.
And to compound that with students, because they're always looking at you like, well, man, if he's panicking, I'm out of here.
Totally.
Yeah.
And I'm thinking, if we're all out of here, I'm leading the way. So that was actually, there's so many stories I could tell, and I don't want to bore anybody with them, but working with wild animals like elk and deer and moose and stuff like that, that gets pretty interesting because you have to leave everybody in exit ramp. So But anyway, I think I got sidetracked. What's the question again?
Just if any story is ever really scared you with like a large animal that you can think of, just one that comes to mind or sticks out.
Yeah, working with bison, they're pretty, it's kind of like a really quick bovine in a horse uniform, or in a horse in a bison uniform. I mean, they're very reactive. And I wouldn't say that I was scared. I wasn't. You'd learn to not put yourself in bad situations,
Sure.
at least try not to. And periodically you end up having to, especially if you got to take one for the team if a student's going to get run over. So at least that's what you plan on. But so I can't think of any where I was totally, I mean, I'm always on your toes, or I'm always on my toes, not yours, but and that kind of keeps you safe if you get lackadaisical or you start to that's a great way to get whacked. And I think it's, what do they say about pilots? You know, there's the new, I don't know, there's some saying about
old pilots, there's bold pilots, but there's no old bold pilots.
Correct. Exactly. And it's kind of, you could just use that as the veterinary corollary to that. And yeah, once you get smacked around a few times or kicked or run over, you tend to try not to do that again.
Totally.
So, yeah. So,
Thinking of a bison is just terrifying to me personally.
Yeah,
well, you know, what's funny is they put up these in the chutes. They have a crash gate, and it's like 8x8 wood panels because they just try to go through anything, and so they can't obviously get through that. So they hit that, and they kind of bounce back, and they're a little bit dazed, and then you can kind of catch them. But yeah, so I wasn't real wild. We didn't have the facilities to work bison, so that presents a problem. But places that have bison and whatnot, if they have the correct facilities, and they obviously learn how to work them, those get you know, they get the job done. The other thing I was thinking about, you know, like when I was at CSU, we'd see rodeo bulls, and those animals are incredible because they're big and they're really athletic, and so, and they can be kind of grumpy periodically. So, yeah, in those situations, yeah. So I had some great stories, but you know, essentially, I would try to like minimize the number of people that were in there and try to get the job done, without a bunch of gawkers. Because if something happens and rodeo bull gets out, then
yeah, that's problematic.
I'm going to try to leave.
So, personally don't want to stay around. Yeah, I imagine there's so many different like ways that it probably don't even cross our minds. Like I remember we were all together a few months ago, and you told us about I think it was mountain goats, or that you cover their eyes and they stop fighting back, which is just such a, I've thought about that often. And I told my husband about that. I'm like, can you believe that? You just cover their eyes. And he's like, well, who was the first person that found that out? Like who reached in, covered their eyes?
It's kind of like Steve Irwin or something, but we would deal with, we had some research, bighorn sheep, and we would get to go out and capture those, and we'd get them with a net. And so they'd go running along a fence line, and you'd pull the net, and the first people in there would try to jump on them and then cover their eyes. And it just, interestingly, it just took the fight out of them. And then you could just kind of hold them down and take blood or whatever samples you needed to do. But gosh, I was thinking about something else here for a second. Yeah, so the gosh.
I have to say, just while you're thinking, I tried that with my kids to see if it was transferable. I've got 8 kids. Bedtime every night is a disaster.
Cover their eyes.
Tackle them down. Cover their eyes. It doesn't work.
Yeah.
Someone had to try it.
Yeah.
Thanks for letting us know, Ben.
Yeah.
Yeah. It reminds me of when Megan, our oldest now, but when she was a little baby, you know, all kids have that immersion reflex. So that you could actually take a newborn and dunk it in water, and they wouldn't, you know, the glottis closes and they wouldn't drown. But you can actually stimulate that reflex by blowing in their face. And so when they start crying, I would just hold her up and go, and she would quit crying. Well, that just really annoyed her. And so it works about 3 times, and then
not
it's
anymore.
worse.
It just cries harder.
It makes it harder.
Yeah.
Oh my
Yeah.
gosh.
Well, let's pivot for just a quick second into you've practiced medicine for, like you said, close to 40 years. You've taught it. You've worked with a lot of students and a lot of animals, of course, over these decades. How have you seen during that time frame? How have you seen veterinary medicine change or evolve? Tell us a little about that journey.
Yeah, that is actually, and I think that's that's a good lead in, because that's where BEMER, I think, has a significant part. When I went to vet school, I think it was about 50-50 female to male ratio. Now, both human medicine and veterinary medicine, I think the ratios are close to 70% to even 80% female versus male students. So that shift has been there, which means absolutely nothing as far as I'm concerned, as long as, it's just the qualified, interested people. And so that's changed. The other thing that I have noticed, even before I got into vet school, you had to do a certain amount of either volunteer paid work in different clinics and things like that. And I noticed some of the practitioners would use pretty rudimentary, even forms of anesthesia for minor procedures and things like that. And they kind of rarely spent a lot of time worrying about pain management and comfort and all this kind of things like that, post-op, whatever it might be. That is huge now, and my hat's off to the profession for doing that. They have this kind of they call it a multimodal approach to pain mitigation, and it can be a combination of various drugs that they use, and also non-traditional things. So acupuncture is becoming a lot more prevalent. BEMER, I think, has a huge place in that. So I think it's going to be very powerful, hopefully, with in the small animal realm. It already is in the equine side of things. And so that approach, kind of a well-being, the longevity, actually, with animals, to keep them happy, keep them comfortable and things like that, and be that either pharmacologically or with things like BEMER, I think are going to be doing nothing but growing. The students these days expect that, and I think that's good. The clients certainly expect it. So it's looking out for the welfare of the animal. So that's probably one of the most significant things that I've seen. And then, of course, technology has grown over the years. I mean, we have all pretty much the similar types of technology that in human medicine. So there's CTs and MRIs and PET scans and all the imaging technology, procedure technologies have come along quite a ways with interventional medicine and things like that. So, yeah. It's the profession's growing just like the human medical profession.
Yeah.
It makes a lot of sense. I like what you said about making it's kind of the thought now, and the expectation, like you said, from students, is to make it comfortable and make it as pain-free or painless as possible for these animals that are going through these procedures. It makes a lot of sense.
Yeah. In fact, there's a veterinarian, I believe his name is Marty Becker, who has a pain-free or fear-free, I think it is, course that people take. And so sometimes if you go to, and again, I'm speaking a little bit out of turn because I'm not a small animal practitioner, but you see some of these small animal hospitals that will say certified fear-free, whatever. And so that's just another example of how that's changing.
Yeah. My dog loves the idea of that.
Yeah.
I'll tell a little story, but he had to have surgery a couple of weeks ago, and I was thinking about it when you were talking about kind of taking the pain and the fear away from it. They said, if you come in a couple days before, if you want to pick up his happy pack. And I'm like,
Yeah.
okay, what's a happy pack? And it's trazodone and gabapentin. So he's basically sedated before he goes in. And I'm thinking like, oh, for people that don't know, I refer to myself as an insufferable dog mom because it's just the truth. But I have an 80-pound boxer and he is very scared of the vet. And so I was thinking, well, he's also very hyperactive. So I'm wondering if this is even going to work. Well, it does. He was very sedated and very unaffected and very happy to go to the vet.
Yeah.
So it did work. So I was appreciative of that because it does seem like something little and small. But I can see how that would make owners of pets and animals, large and small, feel more comfortable.
Oh, absolutely. And now your dog's a junkie, so that's good.
Yeah. Yeah, no, I had to pull it. They were like, well, will you give it to him again before you get before he gets his stitches removed? And I pulled out the bottle and he was like, no. I was like, oh, he did not like it. So anyway, but it was good. It was good to have that option because I hadn't had that presented to me before.
Yeah, that's interesting. Yeah, and some of these new drugs, I mean, I trazodone and gabapentin have been around for quite a while.
Sure.
But certainly used a lot more now. And what's interesting, and I can't remember which one, but even the mechanism of how those work, people aren't exactly sure.
Yeah.
So, but they definitely take away anxieties. So that's good. Yeah.
How do you see? Yeah, I love how you mentioned the evolution of animal care. Not just in terms of treatment, but the emotional care, right? And removing the fear and managing pain better and that type of thing. I love how there is much greater emphasis and support there. How do you see things like BEMER complementing the veterinary medical procedures and things like that to give added support?
Oh, I think there's so much room for that. And so anywhere kind of an animal down and that maybe is going to have minimal, just an examination or something like that, that it may be able to help in that type of situation. And then as you get more and more complicated as to maybe what you're doing, and it's like a preoperative type thing or a postoperative thing or intraoperative where and there's been work certainly with horses that out of Germany where they've used the BEMER blanket, and I have to go back and look at the studies, but definitely found that the recoveries post anesthesia were easier. I believe that they were able to minimize the amount of drugs that were used because the animals just come in a lot calmer. And that's really important with horses because you can take a horse. I mean, it's a risk. Anesthesia is always a risk, but you can have a fantastic induction, get the horse down, everything goes swimmingly, and the procedure is fantastic, and then recovery is a wreck and break their leg or they just tear things apart, and so that's where minimizing drugs, if you could use the BEMER pre-op and/or post-op recovery, keep the animal much more calm and more comfortable, that can be huge. So
I've heard a lot of horse owners talk about that effect that BEMER has on their horses, that calming influence. Walk us through the science of that. How does that work?
Well, PEMF and has a lot of science behind it. And now BEMER is a specific signal that works. And I'm kind of a nerd as far as the pathways and mechanisms and things like that. So it's very well worked out that the BEMER signal will actually allow influx of calcium into the endothelial cells, which then produce nitric oxide, which then goes to the smooth muscles that are around these very small arteries or arterioles and venules or veins that are before and after the capillary bed. So what happens is the BEMER will facilitate the relaxation of those muscles and then also allow the kind of the pumping action of those. So you get better perfusion of all tissues. It tends to have, now the mechanism, it tends to have a enhanced parasympathetic effect. So the body has kind of two modes of action. One is the fight or flight or sympathetic effect, and or the response, and then the parasympathetic is the they call it rest and digest or whatever, but it's more the vegetative state. So the BEMER, especially with horses, puts them into more of a parasympathetic state. So they tend to relax. You see various signs of how the animal relaxes. They may have a particular posture. They may yawn. They may kind of rest their head on things, but it definitely puts them at ease. And so that's part of it. And then there's actually other very interesting things mechanistically, but I think those are the two most important that are very well worked out and very well established. And BEMER's a class 2 medical device, so that it's, you know, it's not only safe, but it's efficacious for what it's supposed to do. And that is to increase microcirculation or circulation through all the tissues in the body. And then has this parasympathetic enhanced effect, which comes in handy, especially with animals and especially horses. So anyway,
yeah.
Did that answer the question?
Oh, yeah, massively. So, I mean, horses are certainly used for, you know, lots of different occupations and purposes, right?
Sure.
So, yeah, and at various ages and stages of their own life. How does BEMER work across that spectrum of the equine experience?
Yeah, well, it works great because anywhere from performance animals, so pre-performance, post-performance, medical conditions and things like that, but just for everyday kind of life for a horse, because not all horses are on a racetrack or petting cattle or doing things like that. So there's pleasure horses that can benefit from it. There's more and more rescue operations where people have oftentimes horses that are no longer wanted, for lack of better words, and so there's places set up, and sometimes these animals they were either retired or no longer wanted because maybe they had an injury or something like that. They could have anything from a bad back to a, you know, whatever. So those types of animals can benefit from BEMER. Your everyday pleasure horse can definitely benefit from BEMER. Horses tend to, you know, we're kind of putting an animal that tends to want to be outside doing stuff, and then we put them into kind of synthetic situations where maybe they're in a stall for an extended period of time and then they're taken out. And so as far as mentally, I think sometimes horses can suffer a little bit from just having them taken care of at our convenience, where they'd rather, you know, running around wherever. So you obviously can't have that happen. So in those instances where the horses may have to be stalled or whatever, I think BEMER also could have a beneficial effect with them, because I think it's just overall health care. Increasing perfusion to all tissues in the body can do nothing but help the body. And there's absolutely no evidence that anything like this has a detrimental effect. It can only have a beneficial effect. So yeah, so everything from the you know, the rescue horse or the pasture horse or the, you know, the performance horse or the horses that need to undergo procedures or whatnot. Farriers, you know, I was just talking to a farrier who uses a BEMER and on the track, and you know, those are can be pretty wound up horses, and he puts the blanket on horses because it's a tough living to be bent over, trimming feet and putting on new shoes. And if a horse is hassling you, it makes a hard job even more difficult. And so that's an example where a farrier is using the BEMER and loves the way it keeps the horses nice and calm.
Yeah, that makes a lot of sense.
Yeah.
Yeah.
I'm guessing there's some horses that have certain personality types as well, where they're a little bit more edgy and bouncy and all that kind of stuff, which would be helpful too, right?
Yeah, I mean, horses are just like people. There's the spectrum, and but then they have the unique built, like I said, they're an on-off switch. There's not a rheostat for the most part.
Sure. Yeah.
So edgy would be a very nice way of saying it.
Yeah.
Yeah.
Sure.
We got to stick to the nice ways when we're talking about horses. We love them over here.
Yeah.
So as a former professor, how do you see a place for BEMER in veterinary school curriculum and teaching hospitals?
Yes.
Yeah.
You know, the profession is relatively conservative. I was listening to I think it was Dr. Milhan talking about, you know, the human physicians and how it's kind of a conservative deal. And I thought, man, veterinary medicine's even worse. And then large animal is like another spectrum. If you're looking at the bell-shaped curve, I mean,
Sure.
they're way off on the side. So trying to get buy-in, the point I'm trying to make is, trying to get buy-in from those people to try it and to look at it, because the profession, just like human physicians, are very evidence-based needs for, we want to have data type thing, and there is, and so what we need to do, and especially with BEMER, is to try to facilitate getting research out there and getting some studies done. I mean, that was half my job, was getting grants and conducting research and then publishing and all that kind of stuff. And so I'm pretty familiar with the whole process. I kind of understand the ins and outs everywhere from the big federal granting agencies and things like that. So what we need is buy-in, get some research conducted, and I think that would help. Interestingly enough, I had right before I retired, we used to have this seminar series called Senior Papers, and it was a requirement for them to graduate. They had to give a presentation, and it's about a 20-minute talk and then answer questions and stuff like that. So interesting enough, the very last semester that I was participating, I always kept an eye on, like, hey, what are the topics going to be? And there was a student that did her paper on BEMER. And so I need to go back and dig that up, because she did a very nice job. So the thing there is that, I mean, I didn't push her into it. She somehow ran into the idea, and then she decided to do her paper on it, and it was really well received. And people were, all her classmates were like, "Wow, tell me about this thing." So
nice.
Yeah, it was good. Yeah.
That's
So
awesome.
anyway, I think, there's a huge opportunity. We just have to figure out, and I think it'll be kind of like a snowball effect. Once you start to get some data and you start to get some buy-in and whatnot, it'll take off. It's huge over in Europe.
Yeah.
Hungary, I mean, it's part of the medical curriculum. One of the guys I hunt with, his nephew he's from Bosnia, and he's just starting his cardio residency. And I was talking to him about BEMER, and he says, oh yeah, we have that. And he just finished his MD, and so now he's going to do his cardio boards. But he says, oh, absolutely. Yeah, it's very common. We all use BEMER.
Yeah.
That's cool. I love that it's being integrated from the beginning, right? Because it does say, I mean, Ben has talked about it's better than having it's better to have a fence at the top of the hill than an ambulance at the bottom of the hill to catch you when you fall, right? So it makes a lot of sense for animals as well, and people to have BEMER in their life.
Absolutely. Yeah, the whole, like Peter Attia's, I can't remember the name of his book, but prevention is where we should be shooting at, not, we're great at treating things.
Yeah.
And but a lot of these things that end up needing treatment have been smoldering for a long time. And it's the same thing with animals. I mean, horses get metabolic syndrome just like people do.
Yeah.
And so there's so many similarities. We got to have lifestyle changes, and I think BEMER would be a big plus for maintaining health. So
I agree.
Yeah.
I agree.
What type of research would you love to see coming out here that you feel would really make a difference in helping other medical professionals kind of catch the vision of what we're working with here?
So, gosh, there's a lot of things I'd like to see. Well, I think the anesthesia thing is really important because, again, especially with horses, it's a high risk situation. We have phenomenal anesthesiologists now that are great, and we have great drugs and support, and they do a fantastic job. But I think the other thing interesting about anesthesiologists, a lot of them are really pretty progressive about stuff. There was a group at CSU when I was there, and Jamie Gaynor and Pete Hellier, and they are the ones that published. Jamie published a article on PEMF in veterinary medicine. But anyway, so they're looking for those things, and a lot of them are acupuncture certified and things like that. Anyway, that's one thing. Personally, I'm very interested in wound healing, and that's just kind of that interest of mine. And I would love to explore wound healing in horses, especially because there's sort of a wound waiting to happen a lot of times. I always said you could put a horse in a padded room, in a cotton ball factory, and they'd come out cut up somehow. So, I mean, I spent lots of time sewing up horses, and you'd be like, how do you do this? And that was so anyway, wound healing to me would be interesting. I think the metabolic syndrome, wound healing is specific because it's local, and you can see dramatic effects. BEMER or PMF and BEMER especially has been shown to enhance what's called neovascularization. So the actual ingrowth of new vessels into a tissue or into a site of a wound or damage or whatever. And so and I'm seeing that personally myself. It's phenomenal, and that'd be a great place to start.
Yeah. You mentioned Dr. Judd Milhon, as a cardiologist, what have you. We had him on just last week, and he shared his story of kind of getting introduced to BEMER, and he'd had some terrible back injuries and repeated surgeries, and was just kind of at his wit's end, and that just kind of took him from the typical closed mind to I'm open to exploring something different here. And what was your entry into considering BEMER as a support in your treatment and your practice and working with animals and things? What led you to be responsive in that way?
Well, you realize who I'm married to, right?
That plays a big part. Yeah.
So I thought about this as well, and because it's a natural question. I got into BEMER, so to speak, if you want to phrase it that way, first myself. And it centered around very much like Judd's issue. I had some back problems, and mine were. He was leaning over with lead aprons on, and I was getting run over by 1,500-pound animals and just doing kind of dumb things, like picking up feet and stuff like that. And my back had a problem. I had several problems, and none of which are great options. As a friend of mine who's an internist said, you know what the number one risk factor for back surgery is? And I said, what's that was? And he said, previous back surgery. So anyway, I had sort of an epiphany when literally my back went out, and I went to two different orthopedic surgeons, and both of them had an MRI done, and they said, you have the back of an 85-year-old. And this was when I was like 59 or something. So I thought, well, that was a nice thing to consider and tell me. And so I had a few injections. We kind of localized where the problems were. And Sue, my bride of 40 years, convinced me to try the BEMER. And and I should say that I had actually had a experience with it before, and that was a couple years before my back went out. But I was in a contest with some students actually, and we were rowing, close to 30,000 meters a day. I think 28,000. Anyway, I after a month of doing that, my back was pretty well toasted, and I tried the BEMER subsequent to that, and being kind of needing more proof, I would use the BEMER one day and my back would feel 80-90% better, and then I would say, well, that was just going to happen anyway. So I didn't. Second day, back was totally screwed up, and so I did that on and off 6 times, and convinced myself that I could actually go to work and not have to hobble around. So anyway, when my back went out with the surgical thing, not hopefully surgical thing, I started using the BEMER again, and it's been fantastic. It's kept me out of surgery for, I got to be careful, and I have times not been, and so just pretty consistent using it. So that was my introduction to it. I had some other phenomenal stories with like bruises and things like that, and watching bruises literally disappear overnight, that have typically, and I know bruises would be lasting 4 or 5 months, and then having these things gone in a week. So so my epiphany, so to speak, was with personal use, and then started learning about it, looking into it, and then retired. Sue's obviously pretty involved, and so meeting people and listening to people, and then delving into the literature. It's fascinating, and you see people like Dr. Milhan and Jenkins and Gaeta, and it's a good group to speak with. And I've spoken with dentists and other physicians and things like that. So
yeah.
And you thought to yourself, well, this worked for me. This has got to work for horses.
Well, yeah. I mean, I think I didn't even know there was a horse unit when I started on it, and then I started going out and anyway, that's some funny stories, but and just seeing how you put the blanket on a horse, and what it does to them, and then starting to communicate with practitioners who have used it for lamenesses and things like that, and seeing the results and heard about the results. And it's this situation down in Oklahoma recently with this horse that had a pretty bad laceration over the pasture, and anyway, it was potentially a game ender for this horse, and with good surgical, there was a little sequestrum in there. They had to go pluck that out, but anyway, the wound's healing very well, and ironically, the clinic is owned by a guy that I did my residency with down in Oklahoma, and I mean, what are the odds? I know one
crazy.
vet in Oklahoma, and this gal was taking her. Yeah. Anyway, so great stories, and but to get come full circle, to get the profession more bought into it, it'll occur over time. I'm 100% sure of that, but it would be very helpful to get some more publications out there, and there's the interest. People want to do that. So
well, I love that you've got such a broad selection of different experiences that you've witnessed with other people and their horses, your own personal experience. I think that's what really opens our eyes up, I think, isn't it? Is they say that people aren't willing to change till the pain of the problem becomes greater than the pain of the solution. Right? And when that is imposed upon us directly versus maybe third hand, that just opens our eyes up. We go, all of a sudden, I'm trying something I wouldn't have considered before, because there is necessity. Yeah.
With yourself, I think too, it's so interesting. Once you see a horse on a BEMER, it's so eye-opening, because they don't have the placebo effect like humans do, right? Like once you watch them relax, it's a pretty from my perspective, not being around horses a lot, it's a really eye-opening, wild experience to watch a horse just fully relax.
Mm.
Oh, absolutely. And yeah, like you said, there is no placebo effect. A horse and to see an animal that tends towards not relaxing, you know, I mean, especially if they're in a foreign situation, to see that happen is like crazy. I mean, it's very interesting, very real. So yeah.
Yeah.
I agree.
Yeah,
It's hard to argue with it. I think the first time I saw it, it was like, wow, it was so eye-opening to watch it.
Mm.
Yeah. And unfortunately, you know, I retired and because there were so many other things I'd love to have thrown the BEMER blanket on.
Yeah.
And so now I've kind of lost a caseload, but yeah. I mean, rodeo bulls get sore backs. I'd love to put it on a rodeo bull. What a great picture that would be. You know,
That would be insane.
That's off label, right? But
Totally.
Yeah.
But every horse for sure needs a BEMER, right?
Yeah.
I think that there's just it just makes so much sense for them all to enjoy the relaxation that BEMER provides them.
It's also it's just interesting hearing how the impact of your own career, the physicality of your own career, just like Dr. Judd's, right?
Yeah.
It's like, you know, it's got a physical impact and consequence that's causing you problems over the long term. And sometimes we don't always consider that when we're talking to vets and what have you. We're thinking of the horse, but we've also got people that are caring for them that are, you know, getting sore and uncomfortable and, you know, out of state.
Yeah, putting
out
their
of sorts.
bodies.
Yeah.
Yeah.
So. I got to tell you a funny story and you can edit this out if you want, but I was kind of asked to go give some few hours of CE for the Montana Winter Vet Conference or something like that. Anyway, it was in what the heck was it? Anyway, it was freaking in January, so it was like 28 below over there. So we went over there, and I think it was some drug company was funding this deal. So they had asked me like 6 months ahead of time, and I said, "Sure, I'll do it. What do you want?" And you know, they said like 4 hours of CE, blah blah blah. And I thought, well, this would be kind of fun. Maybe Sue can go. And so she goes, maybe I can talk about BEMER. So I asked the guy, I said, by the way, would you mind if my wife just took maybe 10 minutes and I'll give her out of my time. And but she just introduced BEMER and the guy was fantastic. He said, absolutely, that'd be great. And so I did my dog and pony show, you know, and then I was kind of looking at the clock and I said, okay, I got like 15 minutes. Sue gets up here. So she had like a few slides and it had gone through, what do you call it? With Michelle, everything was legit. Right. And, so the funny thing was she kind of talked about the equine BEMER and then also mentioned that there was a human one. And anyway, she'd done her spiel and there's people that were pretty interested in it. And so for the rest of the conference, I was kind of sitting in the back by the coffee, you know, drinking coffee and stuff. And Sue was with me and we would, it was classic. Montana large animal veterinarians, these guys would get up and just like hobble like back to the back room and pour their coffee and then go back to their seats. And you know, these are a bunch of old practitioners that have been beat up and drugged through the mud and all this other stuff. Anyway, they came back and started talking to Sue about they were like, screw the horse thing, I want it for myself.
Totally.
And so anyway, she ended up staying after for like an hour and a half giving BEMER sessions to all these old practitioners. And
oh my gosh.
Anyway, she's it was great and ended up selling a few BEMERs, but more importantly got about 2 or 3 of them pretty interested in becoming distributors and things like that. And they've had some phenomenal success. And but she did the equine presentation and they were like, nah, we want the human ones because they're all beat up. So
that's hilarious.
That's awesome. We'll fix our animals after we fix us, right?
No, it was
so
classic,
great.
so,
well, George, this has been really, really fantastic getting together with you and hearing these experiences and certainly getting your insights as a large animal veterinary doctor. I think this has just been wonderful. So before we wrap up, is there any question that you think maybe we haven't asked today that listeners that are owners of horses, or maybe, like you said, are feeling beat up themselves in the way that they've kind of lived their lives with these beautiful animals? Anything that you think we should just kind of give out to them just before we take off and wrap up?
Well, just become aware and learn about BEMER. I think that will behoove them as well as their animals. And it is funny, and Sue has mentioned it, and I've witnessed it, is people tend to take care of their animals first, and then they'll see a benefit, and then they'll think, hey, maybe I should be doing this for myself. So I'm not sure there's a need to change that, or you want to change it. I think just making people aware of it, and then people are people, so not everybody's going to be interested or convinced or whatnot. But like you said, how did you say that? If the pain of the problem is got to exceed the benefit.
The pain of the solution. Yeah.
Correct. Yeah. So I think that'll help. Yeah.
Yeah, fantastic. Well, thank you so much.
Thank you.
Yeah, and we look forward to having you back on at a future time.
Sounds good.